More children are getting sick from COVID-19 and having to go to the hospital due to rising rates of Delta variant infections. Here are some things you can do to keep your child and you safe as you transition back to school in person. Know what your school is doing to keep your child safe. Check in with your school about procedures in place to keep everyone safe while at school. For example, ask, how will you keep parents and caregivers up to date on any changes to the procedures? Will vaccines be offered at school? Are you requiring teachers, staff, or students 12 and older to be vaccinated against COVID-19? What happens if my child's teacher gets sick from COVID-19? What happens if my child gets sick from COVID-19? Get vaccinated. Vaccines are the most important way to keep your children safe and slow the spread of COVID-19. Children 12 years and older are eligible to receive the COVID-19 vaccine. These vaccines are safe and effective at preventing severe illness and death from COVID-19. Because children younger than 12 are not yet qualified for vaccination, it is even more important for the adults who surround them to get vaccinated, including parents, caregivers, extended family, teachers, and staff. Wear your masks. Masks work. They limit spread of germs from one person to another by blocking virus particles from entering the air and protect the person wearing the mask from breathing in virus particles in the air. The CDC recommends consistent and correct mask use for all children and adults 2 years and older, including students, teachers, staff, parents, caregivers, while indoors, regardless of vaccination status. Mask use is recommended for those who are outside in crowded areas or in activities that require close contact with others. This is especially important for those who are not vaccinated, which includes children younger than 12. Make sure to talk to your child and encourage them to wear their masks while at school. Maintain physical distancing. Talk to your children about keeping physical distance. Children should keep 6 feet apart while eating since it requires taking off their mask. While inside, the CDC recommends keeping children at least 3 feet apart with use of masks to help reduce the risk of transmission. What about sports, PE, or recess? Being outdoors is better than being indoors. If these activities are held indoors, masks should be worn as much as possible, distance should be maintained as much as possible, and the room should have good ventilation, which can be achieved by opening windows and/or having air filtration systems in place. Stay home when sick and getting tested. If your child is sick, they should not go to school, socialize, or participate in any extracurricular activities and should be tested for COVID-19. If your child tests positive for COVID-19, they should not go to school, socialize, or participate in any extracurricular activities, even if they are not showing symptoms. Please isolate your child and contact your school to follow their instructions for isolation. If you or anyone in your household tests positive, follow your school's guidance for quarantine. Wash your hands. Teach your children good hand hygiene by reviewing hand washing techniques, washing with soap and water for at least 20 seconds. Encourage them to wash their hands or use hand sanitizer before and after use of playground equipment, eating, or using the restroom, and before, during, and after use of shared materials. Hopefully, these tips can help you and your children stay safe while we transition back to school and while we determine whether we can vaccinate those children younger than 12.